through chapter 1 through 5. We're preparing you for your national exam. You all know that your national exam is 100 questions, A, B, C, and D. There's not any true and false. It's just straight A, B, C, and D. You have 100 questions. You have 2 hours to take your exam. Your exam is being timed. Your exam, you can take it in the privacy of your own home. You can take it at work. But the main thing is you have to be somewhere where you have good Wi-Fi. So I tell some people, if you need to go to the library, go to the library. Where I live, my Wi-Fi is slowly. So of course I wouldn't take something important, at home. So I would have to go somewhere in the city where I have good Wi-Fi. But make sure that you have good Wi-Fi. I tell everybody, if you have kids, get somebody to watch your kids for about 2.5 hours. Because, like I say, you're being timed. I think each question you have about 2 minutes to take your test. Because of COVID, like I said, you can take it in the privacy of your home, wherever you want to take your test. But it is designed where you can't cheat. I know a lot of people have in their mind that, okay, I'm going to answer my question. I'm going to have my study guide right here. They're not going to have your test like, okay, questions 1 through 10 is from chapter 1. Your first question might be from chapter 5. You're not going to have time to flip through. You're not going to have time to get your husband to look up an answer for you. So make sure, if you just study the study guide, don't just go over the information that I provide for you. Study this entire study guide. This is your exam. Nothing but this here. You'll find some people that'll go out and take tests on YouTube and take tests on Google, Chrome, and all that. That's fine and good. But remember, the people who wrote this test, people who wrote this study guide, these are the ones that wrote your test. Make sense? So it doesn't do any good for you to go out there and just try to Google up some questions and answers. If you want to make up you some questions and answers, make them up out of here. Okay? But again, like I said, there's 100 questions. You can miss 34. But who wants to miss 34 questions? Nobody. If you study what I tell you to study, and if you read your study guide over and over, you'll do very well. Okay? If you don't study, it will show. Makes sense. There is 46 pages in your study guide. I know we have busy lives, but I tell everybody, do yourself a favor. Look at least a chapter a day, or look at least 8 pages a day. Okay? Any questions, any concerns? I know we have one scared person. Okay, so open up your study guide. There is 5 chapters in your study guide. We're going to talk about chapter 1, the phlebotomist. It's real short and sweet and straight to the point. There's chapter 2. The majority of your test will be coming from chapter 2. Then we have chapter 3. There's, I'll say probably about maybe 50% from chapter 2, probably about 30% from chapter 3, and then the remaining for your test. Then we have chapter 4 and 5. So let's start with chapter 1. Chapter 1 consists of what we call the phlebotomist. That's what we're in here for, right? The contents that we're going to discuss is our job duties and our responsibilities, the work environment, and the safety considerations. So we're going to start over here on page chapter 3, and I'm just going to do like a little highlighting. Okay, let's go on page 3, where it talks about a type and cross match. So what they refer to as a type and cross match. For example, I go out here on this main interstate out here, and someone runs a red light. We have an accident and they have to transfer us to the hospital. The first thing, if I get to the hospital, if the physician says that I'm going to need a pint of blood or 2 or 3 pints of blood, the first thing they need to know is my blood type, right? Because if my blood type is O negative and they give me A positive blood, I can have a reaction, I can have a fatality, which I could, die because my blood does not match. So that's what they're referring to as a type and cross match. We have to have our blood checked to make sure what our blood type is before we can have a blood transfusion. So know that a type and cross match is a process that takes place for transfusion to determine if a patient will react after a transfusion. Come on down to this next paragraph, and let's talk about what the definition of a pre-analytical phase is. This definition is it's a process of collecting a specimen for further laboratory testing, such as clinical pathology. It focuses on the study of disease, of laboratory testing of bodily fluids, such as blood or urine, or anatomic pathology. It focuses on the testing specimens, such as biopsy tissue. Underline the word biopsy tissue. This is known as your pre-analytical phase. So learn that definition. The next bullet, when we hear the word neonatal, what do we think about? Infants or babies. So know that a phlebotomist that works in a neonatal department, or if they're collecting blood from newborns, these infants are a few hours to a few days old. It's just what it says. Then come down here where it says therapeutic phlebotomy. We're going to learn more about therapeutic phlebotomy in chapter 5. But in chapter 1, I want you to know that therapeutic phlebotomy, this is the removal of large amounts of blood. You see where they have that in parentheses? One thing that I've learned about this curriculum, when you see something in parentheses, trust me, you will see it again. If you see numbers in your study guide, you will see it again, okay? So know that therapeutic phlebotomy, the definition is it is a removal of large amounts of blood. It treats 3 conditions. The conditions are, number 1, hemochromatosis, number 2, porphyria cutanea tortia, and number 3, polycythemia. If you all read chapter 5, you will remember reading about therapeutic phlebotomy. And when we get to chapter 5, we're going to learn the definition of these 3 that I just called out, okay? But for right now, for chapter 1, know that therapeutic phlebotomy is the removal of large amounts of blood, and it's used to treat those 3 conditions. Okay, come down to this next paragraph here in the middle, and know that it is important to practice cultural sensitivity as well as learning other values, beliefs, and traditional practices. And what they mean by this here is, in so many words, no means no. If you come in my room and you tell me that you want to give me a blood transfusion or you need to take blood from me, if I tell you I said no, that's what I mean. If I'm a Muslim or have some type of other type of religious preference, if I tell you I'm not going to receive blood, you can't force me to do anything because of my beliefs, my values, and my traditions. And no matter what you say, it's not going to make me change. So you have to respect that, okay? So this last bullet down here at the bottom of the page, it says that the work duties of the phlebotomy technician is characterized into 4 major groups. Number 1 is equipment. Number 2 is procedure. Number 3, patient care. And then number 4, records and patient information. So what the national exam normally does is, you see how you have these 4 bullets? It says the work duties of the phlebotomy can be categorized into 4 major groups. They'll probably give you 3 correct answers. 1 is incorrect. So that's why we have to know all 4. So we need to know that it's equipment, procedure, patient care, records, and patient information. Okay, let's move on to page 4. Come down to the bottom of page 4, and it talks about quality improvement methods. And quality improvement methods is just what it says. What can I do to improve a process, or what can I do to improve a job task? So we need to know the 2 definitions for flow chart and Pareto chart. A flow chart, the definition is it is used to break out components into diagrams in order to understand a process. Then we have what we call a Pareto chart. This is kind of like what I use at my job. This is a bar chart that is used to show frequency of problems. What we do on my job every month, we get a list of how many people did we touch. For just say for the month of March, I might have just said touched 110 people. How many was successful? How many had a hematoma? How many had a reaction? How many was an arterial stick? And you know, we do not stick arteries, we only stick veins. But it's a list of just showing you how to avoid mistakes and problems. And of course, we don't want to have problems. Okay? So know the definitions for a flow chart and a Pareto chart. Then come down where it says quality control records. Quality control records should include the following. You have 6 bullets. We want to make sure when we're doing quality control, which is like QC, you want to make sure that everything, you check your expiration dates. If you use something that's out of date, guess what? We just worked in vain, right? So you always want to check your expiration dates before the beginning of the day. You want to check the stability information, your storage information. Some equipment is set at room temperature. Then we want to make sure we always use proper usage by following procedure and protocol, precision of testing supplies and reagents, and the accuracy of testing supplies and reagents. Okay, we're going to skip over page 5 and let's go to page 6. Right here, around in the 3rd sentence, it talks about universal precautions. Universal precautions requires that all used needles must be discarded how? Intact. Underline the word intact. We never recap a needle. We always discard our needles intact. So let's go down here and talk about protective isolation. Has anybody ever gone to the hospital and when you're walking down the hall, you look up to the side and on this patient's door, they have a gown over here. You see the yellow gown? They have a gown. They have masks on their doors. They have gloves. You ever saw that on a patient's door? That means that person's in protective isolation. And what this means is before you enter that room, you have to be called what we call dressed out. We have to have on this hot gown called the gown. You have to put on gloves. You have to have a mask on, your goggles, everything. You have to be dressed out. Everybody hates going in that room because it's so hot. And you have in your mouth, it's gonna run in here and run out. You can't do that. That person is sick. You're harm to them, they're harm to you. So I tell everybody, you might have left your stethoscope in there, and it might be one of these $110, $150 stethoscopes. It's gonna run in, run back out and get it. You got to get dressed out is what we call it. So it tells you when you're in protective isolation, it's necessary to wear, number 1, a mask, your gloves, your coat or gown when coming in contact with this patient in protective isolation. A lot of times these people might have a staph infection, they might have MRSA, they might have tuberculosis, whatever the concern or condition is, you have to protect yourself, you have to protect them. And this is called protective isolation. Okay, if a patient develops an infection while in the hospital that they were not present with before hospitalization, the infection is called nosocomial. Underline the word nosocomial. What this means is, just say for instance, you go to the hospital today. Just say, okay, she has her baby today. She goes to the hospital. She has a beautiful baby. Everything went fine. Well, in the morning when she wakes up, she has a staph infection. Now, when she was in class today, she didn't have a staph infection, right? But now she's gotten to the hospital. She's been in the delivery room. So somewhere down the line from the time you entered into that hospital, you had your baby, you ended up with a staph infection. Now, you didn't have a staph infection when you left home. So apparently somewhere, something was done that was uncleansed and was not sterile. So now you have a condition that's classified as what we call nosocomial. Okay, there's 3 things that you have to have an infection. The chain of infection usually includes number 1, you have to have a source to get an infection. You have to have a susceptible host for an infection. And then you have to have poor isolation technique. And that's what I'm referring to when she ended up getting this nosocomial condition. There was poor isolation technique. Something was not cleansed properly. Okay? Let's talk about what's the number 1 way to prevent infection or the spread of infection. What's the number 1 thing we can do now? What are we doing all day long now? Hand washing. Highlight that bullet. Hand washing is the single most important way to prevent the spread of infections. When we were in school, they taught us to sing the happy birthday song, and that's how you knew that your hands are cleansed and they're washed properly. Okay, come down to where it says equipment. A autoclave. When we think of the word autoclave, what do you all think about? What you think about when you hear the word autoclave? Sterile. It's just like a big dry cleaner. Most of the time, the places where you're going to find an autoclave is in your surgical department, in the dental department. You know, if you go to the dentist today to get your wisdom tooth pulled, you know how they have all those silver equipment on the table waiting for the dentist to come in and use. At the end, all the equipment that's not disposable that can be thrown away, that has to go into what they call an autoclave. It's a big, like a steam cleaner. And the definition is it's an instrument that's used to sterilize under pressure. That's all it is. It's just like a big, that's how they clean all their instruments in all these surgical facilities, in the emergency rooms, in the hospitals, everything that's not thrown away. We use an autoclave. Okay, emergency needle stick information. So, if, just say you're out here working, today is your first day at work, and you accidentally get stuck by a needle, are we gonna hide it? No, never hide it. There's help out there. The first thing that you're going to do if you have emergency needle stick, if exposed to blood due to a needle stick or other sharp objects, the first thing we want to do is wash the needle stick and the cut with soap and water. If it's in your eyes or on your skin, you want to flush that area. You want to report that incident to the supervisor, never try to hide it, and then seek medical attention. But for test purposes, we need to know that the first thing we need to do is to wash that site. Okay? And guess what? That completes chapter 1. Anybody have any questions about chapter 1? You see, it was real short and sweet, right? Any questions? Any concerns?